the debate about healthcare and their lack of plans for it is building. Sometimes, they feel a little bit of pressure, but they send out people like Senator Bernie Moreno to, lie about what it is that's going on and how they have a plan. See if you hear a plan anywhere in this conversation.
Senator, you're saying that Republicans do have a plan.
Absolutely.
What is that plan?
Well, we have to have
can people see it?
Sure, we have to have PBM reform. We have to look at the ways that we have a lot of waste, fraud, and abuse in the healthcare system. We have to let the marketplace work. There's no transparency or competition. You look at some things like, for example, the Oklahoma City Surgery Center and what they're doing. That's really innovation in healthcare, more remote, having nurses be able to treat patients in a different way. The whole system can be looked at very holistically, but it's going to take 3 or 4 months to really bring a consensus to that plan. In the meantime, what are we going to do? Keep the government closed for 3 or 4 months every time that we have a policy debate? This is nuts.
Okay, so is there a plan ready tomorrow, or you're saying it's going to take 3 to 4 months to coalesce around a plan?
Look, we have different Republicans, for example, Senator Rick Scott, that's brilliant on this topic, that has a lot of amazing ideas. But yeah, of course, we have to build consensus. This is not a one-man show that runs the United States Senate. We have to bring Republicans together. It should be bipartisan. I think the voters expect us to work together on difficult things, but we can't have a gun to our head and have the government closed and people suffering, not being able to feed their families because the Democrats think it's good for them politically.
Senator Moreno thinks that he's good at this just because he talks fast and goes with these blame game, normal talking points that Republicans are pushing. But none of that, he said, was a healthcare plan. Did you notice that? None of that was a healthcare plan. What that was saying we need 3 or 4 more months as things continue to destroy people's wallets and they lose their healthcare or look at bills that they just can't obtain. As we do that, it's all the Democrats' fault. We need to coalesce around a plan. Also, he brought up bipartisanship. At the same time he brought up bipartisanship, he went straight into saying, but we can't be held with a gun to our heads. So when the other party that would make it bipartisan talks about things that you need to do to come together, to come to a middle ground, all these things, it's called having a gun to his head. But at the same time, it should be bipartisan. How the hell does something become bipartisan if you call bipartisanship at the same time having a gun to your head? That's denying the opportunity for any bipartisanship. When in reality, the question was asked, Senator Moreno, do you guys have a plan? Because that's nothing that he ever answered. And she gave him more chances.
What is someone who has open enrollment starting November 1st supposed to do in response to the idea that it would take 3 to 4 months to coalesce around a plan?
Look, Obamacare is a total and complete disaster. Having the COVID era.
But what's Republicans' plan to counter that? I think is my question.
I'm answering it for you. Look, we can't fix Obamacare in 3 months. What I'm telling you is that the COVID era subsidies are a tiny fraction of any increase. The increase is happening because Obamacare is broken. It's a complete abject failure. There isn't a single Republican that voted for Obamacare. This is a Democrat plan. You should ask the next Democrat that you have on, what is your plan to fix your health care plan? Because it's objectively terrible. We will bring competition to the marketplace. We'll absolutely increase transparency. We'll have PBM reform. President Trump has done a ton to lower prescription drug prices. We're going to have most favored nation status. We can do it, but we need to put together a coalition to make that happen.
I'm not defending Obamacare or the subsidies on that, but it has been 15 years. I know you've only been in the Senate. You're new to Washington, relatively new, but some people may say, well, there's been 15 years since Obamacare passed. We haven't seen a Republican plan to replace it.
Well, Obama was president for 4 years. President Trump was president for 4 years. And then, of course, Biden came in and made everything objectively worse. And by the way, you can't defend Obamacare because
you're
it's indefensible.
acknowledging there was a Republican president in between those two Democrats who's now back in office.
In a very different situation. He only had 2 years of unified control of government. We got the most important bill done, which is tax relief for all Americans that stimulated our economy. And it had not been for COVID, we would have been in a totally different situation. Had President Trump had a second term that was consecutive, it would have been a very different situation.
He didn't answer the question. I want you guys to notice this pattern. Every time that they're talking about healthcare and how they have no plan, they bring up a bunch of little aspects of things that also they're not doing. Where is that whole thing about prescription drug prices? Remember, Trump said multiple times he's going to bring down prescription drug prices by 1,500, 1,600, 1,700, 1,800%. And none of that make any sense. I'm not sure where that is. I also remember him being on the debate stage when Kamala Harris kicked his ass around, and then he said also he has, remnants of a plan, or like thoughts, concepts of a plan that he's got. I still haven't seen it. So when they're cornered, they bring up the ACA, Obamacare. Again, which those subsidies are expiring. And that's why people are now on the verge of panic, not knowing what they're going to do, because that's been saving them to this particular degree. Obamacare, the ACA didn't go far enough. They think people are not supposed to remember. Something else they think people are not supposed to remember is that when those healthcare exchanges were offered to those states, states could choose to take part in those Medicare, in those exchanges, to lower the cost for their citizens or not. Republican states overwhelmingly chose not to. That hurts their constituents. That hurts their voters. It's done that for the purpose of, once those things suck for them, because they're not utilizing the entirety of the ACA plan, then their citizens go, well, the ACA sucks. And then people like Senator Moreno come forward and sit on CNN and say, doesn't the ACA suck? Well, yeah, y'all sabotaged it. That's the whole point. Politics are always placed over the citizens of this country for these particular politicians. That's how they operate. Now in 2025, they're talking about the Affordable Care Act and how it sucks because they sabotaged it. That was the whole idea. So now when asked again, where's your plan? There's more excuses. Did you notice? He's talking about COVID then happened. And while Donald Trump was in office, that's a totally different situation. She asked him, you mentioned Donald Trump had a chance. What did he do? He did not do anything. This guy brought up his tax plan in his first term, which also was a disaster for regular Americans. That's how they operate. That's how they think. Here's another. This guy's a congressman, not a senator.
Are you comfortable with healthcare premiums possibly doubling for your constituents? Time is running out, and there's an estimate that millions of Americans could lose their insurance if something isn't done about these premiums, right? So there's that issue. Go ahead.
I think that's just a Democrat, talking point to promote fear and to push people. There's going to be changes.
I'll cite the source. It's the think tank, the Urban Institute. Right. I just want to cite the source so our viewers know. It's the think tank, the Urban Institute. It estimated that about 4 million Americans would become uninsured after 2025 without the federal subsidies. And that includes 88,000 people from your state of Indiana. You also have Republicans like Marjorie Taylor Greene sounding the alarm about this.
Yeah, but Marjorie Taylor Greene doesn't speak for, most Republicans in the conference. Again, Speaker Johnson and Senator Thune and President Trump are going to be the leaders on this, not Marjorie. And so I think that what we need to remember is that Obamacare has been a failure over the past decade. And that's why our costs, right now, Pamela, our insurance and our healthcare industry, it's a wreck. The entire healthcare system is now in shambles because of the system that's been created over the past years under Obamacare.
Stutzman started by saying he doesn't even believe that healthcare costs are about to rise. They're about to skyrocket. That's a Democratic talking point. That's some kind of propaganda carried out by Democrats. After he was dispelled of that bullshit lie, then he moved on to then talking about how Obamacare is a disaster. Do you notice the pattern? Start with your first lie. When it gets exposed, go to talking about Obamacare, because that was the bomb that we put in place a long time ago to sabotage any kind of healthcare for Americans. So we could always say, look at Obamacare, it sucks. When they made sure that it sucks. And the reason there was a debate over the ACA at the time is because the Republicans didn't want any health care plan. None. That's been their stance since the beginning. I'm going to show you guys what one of the people that's in Trump's whole cabinet now, Dr. Oz, the way he thinks about what health care should mean for the American people.
Medicare and Medicaid Services Administrator Dr. Mehmet Oz says that President Trump may have a plan to replace the Affordable Care Act altogether.
What the healthcare system should do is not just pay the bills. We should make you so healthy that you flourish in life and you want to engage the workplace. Getting America back to work full speed, getting you to work longer if you desire, that builds trillions of dollars of value to the GDP. And that's the goal of the health system.
No, it's not. The goal of the healthcare system is not to build more money for the GDP, to make sure we have people working their asses off. I mean, if you have a broken ankle, you can't really, be a part of the cog of the system to continue to make sure our oligarchs and all the people running our politicians that paid for them to be run by them. We need more workers. That's the goal of the healthcare system, to Dr. Oz. Isn't that weird? So because there's all this talk about the government shutdown and how Republicans don't have any plans, pressure is building on Mike Johnson. I've been saying this for a couple weeks now. Pressure is building on Mike Johnson and other Republicans. They're pretty afraid about this whole thing. So they're trying and they're scrambling and they're shooting themselves in the foot while at the same time acting like nothing is wrong, but then stuff is wrong. Here's where some things are going worse for them. There's a list of Republicans that are frustrated with Mike Johnson's strategy of ensuring Congress doesn't do anything while the government shutdown is growing. Texas Representative Dan Crenshaw expressed concern about how the House could make up for all the time it's spent in recess. They had a whole conference call where they were getting with Mike Johnson. So Mike Johnson's taking it from multiple angles, but they're not really all that mad. Here's more information. Johnson, who's also been at odds with Marjorie Taylor Greene, who was brought up in that previous guy's interview, since she broke with him on the shutdown strategy, said that Republicans had been working day and night on healthcare solutions and whined that Greene shouldn't bash her colleagues online. And he asked her, how does that help us, Marjorie? So she's been working day and night. You would think that some of these folks who go on TV and talk about the lack of plans from Republicans, you think they would have something to say about those plans for Republicans, but they don't have any. Every time they tell you they've got something, wait for the answer before you accept and move on. Here's more information about, some of the folks turning on him. Republican Representative Kevin Kiley of California also expressed frustration with the House being closed during the shutdown. Also, Don Bacon of Nebraska said the Republicans should be negotiating with Democrats on Obamacare after that whole call where they got into Mike Johnson's ass. So there's a couple guys that are turning on him, or at least they're saying he should do something different, or maybe they should talk to Democrats. If there's Republicans talking about how we should be talking to Democrats, that means they're not talking to Democrats, despite the fact that that first guy, Senator Moreno, said we should have a bipartisan agreement on these types of things, except we won't talk to anybody because Donald Trump told Mike Johnson to not let anyone talk to anyone. Here's more. Here's a quote from Don Bacon. I do think we should be negotiating the ACA tax credits and have that compromise to put in the appropriations bills. Though the grumbly conference call suggests small cracks, this is what I was talking about, you shouldn't get too excited about. The GOP's shutdown stonewall doesn't yet appear ready to break. Johnson has maintained that the vast majority of Republicans agree with his strategy, while senior Republican House members on the call agreed that there's not a widespread revolt against Johnson quite yet. Just saying. We can keep looking for little pieces of good news, and I promise I'm looking for them. I'm pointing out how Mike Johnson appears to be cracking. I point out how Donald Trump also called him his puppet and how he's both the president and the Speaker of the House because Mike Johnson is his minion. Those are all, I guess, decent news, but Mike Johnson eventually might might be running into more of these brick walls with his snake oil salesman face, the smarmy sumbitch. But they mentioned Marjorie Taylor Greene there, who I want to continue to make sure you guys understand. You shouldn't trust anything she still says yet because her actions aren't following them up. She's saying things. She's still supporting the president who's controlling this Speaker of the House that she said is the problem. Just want to point that out. But he did have to answer for some of the things that she's been saying about this shutdown and their lack of a plan.
We heard from one of your members today, Marjorie Taylor Greene, who wrote this morning that on y'all's GOP conference call, she said Speaker Johnson said he has ideas and pages of policy, but did not say a single policy plan. She said, I find it unacceptable that Republicans are sitting on the sidelines doing nothing to fix this healthcare disaster that is leading many Americans into financial ruin. That's her words. She says you're sitting on the sidelines. What's your response to Congresswoman Marjorie Taylor Greene?
Well, bless her heart. That's an absurd statement. Obviously, these conference calls are monitored by media, so we're not going to have actual strategy discussions on a line where you have hundreds of people listening in because it would be reported on the front page. We have been working on this for a long time. We worked on it today. We've been working on it every day. Marjorie is not here in Washington. She's not on the committees of jurisdiction, and she's not involved in those specific discussions, but she will be soon because they'll be related to all the House Republicans. This was always going to be a discussion and a debate that was going to be held in bipartisan fashion, by the way, in the month of October and November. We know that the end of the year is the end of those COVID-era subsidies, and there's real reforms that have to be made if they're going to be extended. The Democrats knew that, the Republicans knew that, and it was always on the table for discussion. They have made that a red herring issue for now, again, because they wanted to show a fight against Trump.
Excuse number one from Mike Johnson. We're not going to talk about our healthcare plans, all these deep-rooted healthcare plans that we have ready to go. When just before that, he was talking about how they have to have some more coalescing around all of their talks. There's no plan, but that's the first excuse. The second one, since again, when you get cornered and you're asked again, so where the hell is this plan, Mike? It goes back to all those empty things that Senator Moreno said at the top.
Speaker, she's saying that the Republicans aren't doing anything to address the health care issue here that Democrats are arguing about. Are you saying that there is a Republican plan and you're just not talking about it?
No, I'm saying there's lots of discussion about it, but we don't relay it on a conference call with hundreds of people listening in. We have many ideas on how to bring down the cost of health care, to continue to do that, and we've already demonstrated it in the Working Families Tax Cut. We had real reforms to Medicaid that you and I have discussed that have brought down the cost and saved about $185 billion for taxpayers and made the program stronger for the people that actually rely upon them because we got ineligible enrollees off the program. We have many ideas like that to bring down the cost of health care and increase access and quality of care. And all that will be rolled out in the days ahead. We have plenty of time to do it. It was always going to be done at the last quarter of the year. And that's what we're waiting on. And that's why we need the Democrats in the Senate to stop this crazy gambit, do the right thing, and reopen the government so we can finish all that work.
And right back to the fraud, waste, and abuse lines. Talking about how they've eliminated all these people who don't belong to be on the healthcare systems, which has been debunked about 1 million times. It's the same filing system of excuses, propaganda, and talking points that continue to get debunked. But the problem with debunking people who are committed to lying is that after you debunk it, they go right back to the lie as if you never pointed out and proven how much of a lie it is. They don't care about convincing anybody. They just care about talking about it long enough while they do the other things behind closed doors that they're doing. So that's why the arguments are unnecessary. He doesn't care about reality. He doesn't live in it. He's falling behind Donald Trump. I saw this right before I came on. It's always fun times to play Ted Cruz and the ways that he thinks he's actually appealing to people or makes any damn sense. Here's Ted Cruz. He got up off his knees for a second and let go of Donald Trump's ass cheeks, and he went on CNBC.
Well, Joe, my advice is don't spend much time worrying about Marjorie is saying. What I found is a pretty consistent pattern is that whenever an elected official decides that they're going to turn on Israel and they hate Israel, you will very quickly see every other policy out of their mouth become very, very liberal. And so suddenly Marjorie's for massive government spending and taxes, and she's for open borders and amnesty. Okay, fine. That is not where the American people are. Where the American people are is real simple. We're on day 29 of the stupidest shutdown.
Ted Cruz said that now that Marjorie Taylor Greene has turned on Israel, okay, now that she's done that, there's going to be all this litany of all these lib policies that she's all about. Suddenly she's all about open borders, tax and spend. This president, who's bringing in hundreds of millions of dollars into his pocket, who's profited $5 billion for his family, who's building the Arc de Trump and is building a bunker underneath the White House. I mean, after he destroyed the east wing of it, his ballroom and bunker under the White House, has gotten Kristi Noem 2 new jets. You mean all that spending while people are losing jobs and their income is drying up and tariffs are costing them even more things? It's weird how the guy just runs through the same standard talking points, because that's what's always been said to people that just listen to them going, well, that's my team. He said that they're the tax and spend party, despite the fact that he's literally spending as much as possible on himself and all of his oligarch friends. It's weird how he just is dumb enough to think people are going to listen to that and pay any more attention to him. That's his answer, though, to Marjorie Taylor Greene and her turning on the Republican Party. She ain't turned on anything. So get that thought out of your mind, too. She's not turned on him at all. She likes to say things to cover her ass and make herself look good in the moment. I'm waiting for the action from Marjorie Taylor Greene. I'm waiting for that first.